Acute coronary syndrome is a medical term used to cover a broad range of conditions where the blood and oxygen supply to the heart muscle is suddenly blocked. One such condition is a myocardial infarction, commonly known as a heart attack. The myocardium refers to the muscular tissue of the heart. The word infarction comes from Latin and means to plug up or cram. This cramming is typically caused by arteriosclerosis, a chronic disease that causes plaque, cholesterol, and other substances found in the blood to thicken, harden, and narrow the coronary arteries. When the pre-existing coronary artery plaque breaks, a blood clot forms and lodges in the blood vessel, blocking the flow of blood and oxygen to the heart muscle, causing a heart attack. Less commonly, a severe spasm or sudden contraction of a coronary artery can stop blood flow to the heart muscle. The more time that passes without treatment to restore blood flow, the greater the damage to the heart muscle.
Help!
The symptoms of a heart attack vary from person to person. Heart attacks can start slowly and cause only mild pain or discomfort. Symptoms can be mild or more intense and sudden. Symptoms also may come and go over several hours. The most common symptom is chest pain or discomfort. Other symptoms include upper body discomfort, such as pain or discomfort in the left arm, both arms, the upper back, neck, jaw, or stomach. Shortness of breath, feeling weak, lightheaded, or faint, and cold, clammy, sweaty skin can occur with heart attack, as well as nausea and vomiting. Women are somewhat more likely to have shortness of breath, nausea and vomiting, unusual tiredness, sometimes for days, and pain in the back, shoulders, and jaw.
What's going on? Help!
Sudden cardiac arrest, or SCA, occurs when the normal electrical impulses in the heart cause it to beat too quickly, inefficiently, or in an unsynchronized manner. SCA results from a problem with the heart's electrical system. With SCA, the heart suddenly and unexpectedly stops beating. Blood flow to the body, along with the oxygen it carries, abruptly stops. Cardiac arrest happens suddenly, and often without any warning signs. A victim of SCA will be unconscious, unresponsive, and not breathing normally or only gasping. With a heart attack, the heart generally continues to beat, despite the blockage, and the person remains conscious and responsive. A person who is having a heart attack may deny it.
Something's wrong.
What's going on, sir?
I'm okay. I just don't feel very good.
But delays to medical care can jeopardize the person's life. Assess scene safety and take standard precautions. Assess responsiveness. Activate EMS and/or EAP. After activating, and unless they are readily available to you, send someone to get the first aid kit and an AED. Assess breathing for no more than 10 seconds. Follow the procedure based on your findings. If the person is breathing and appears responsive, obtain consent.
Okay, yeah, control. Hey, can we activate the emergency action plan? And I'm gonna need an AED as well. We're located by the bird cages, and we're sitting on a bench right now. He looks like he's having chest pain.
Calm, comfort, and reassure the person. With consent, loosen any tight clothing. Allow them to find a comfortable position.
Is there aspirin in here?
Yes, right on. Yes, we have a white male. How old is he? 45.
The early administration of aspirin for heart attack can be life-saving. Unless the person has a known allergy to aspirin or has been advised by a healthcare provider not to take aspirin, encourage the person to take aspirin. Aspirin can help prevent blood clots from forming in coronary arteries and can reduce heart damage. The suggested dose is 1 adult 325 mg tablet or 2 to 4 low-dose baby aspirins, 81 mg each, chewed and swallowed. The aspirin should not be coated. Stay with the person until someone with more advanced training takes over or EMS arrives. Be prepared for the possibility of sudden cardiac arrest and the need for CPR and the use of an AED.